have gathered here to discuss about the advantages, the applications of teletechnology, particularly the case study of teletechnology, how the patients, the people are benefited using this teletechnology. We can start the discussion.
So I would like to start this discussion. So chronic kidney disease patients undergoes dialysis continuously, but why we use telehealth in this things? We use remote patient monitoring for the patients to remember the next consulting dates, so that we can reduce the complications like fluid overload, hypertension, infections, etc. So there are many integrations over this telehealth on the dialysis of the chronic kidney diseases. So there are blood pressure, heart rate, ultrafiltration, diagnostics of temperature and flow measurements, and finally the treatment duration can be diagnosed.
So the key components of telehealth technology includes video conferencing. So it is like a one-on-one interaction between the doctor and patient. This reduces the accumulation of overloaded patients in hospitals. It can reduce 60% of crowd in hospitals. And mobile health, which is MH, we can take Apple and also other kind of initiatives from bigger industries which include health apps in their own systems. And remote patient monitoring. We can't undergo continuous monitoring in hospitals, for example, in the dialysis case. So in such cases, for chronic diseases like heart patients, we use Holter monitors and stuff. So they can also undergo telehealth, which will also not affect their individual lifestyle. They can, continue their own thing. Example, epilepsy patients also. They have to have a good record of continuous measurements of the epilepsy and seizures and all. So in this way it can be avoided. And store and forward technology. For example, ECG or EEG, all those reports can be stored and can be forwarded to the chief doctor, and they can have a consultancy. And then electronic health records, again, we can view our own medical data in e-platforms. It cannot go missing like the hard copies. So this way, telehealth plays a vital role in medical health.
And the advantages are reduce hospital visit and improve access care, convenience and comfort, reducing hospitalization and better for conditions, and there are more advantages.
So talking about the future structure of healthcare, first we'll talk about the maternal healthcare checkup. That is that during the pregnancy period of pregnancy, it takes they are very complicated by the time of the situation. So to avoid the travel and these kind of things, we can store their scan report data in their room, and using that the doctor can check it by using the video call options and etc. And telehealth also helps in VR and AR tech. Nowadays VR and AR are popular in games, but in talking about the healthcare, we can use a virtual therapy in that also. We can see the patients and doctor in the virtual vision. And 5G technology in telehealthcare, 5G is a very fast growing network in this period of time. So using this video call options will be in a clear way, so that the doctor can easily see the patient and check their condition and etc. And IoT, talking about the IoT in telehealth is nowadays we are always wearing the smartwatch and these kind of things. In that we can check our heartbeat, stress, depression, and these kind of things are able to view. And AI prediction, that using some AI predicting device in the human, which can help them to detect the disease or infection caused from the human body is easily can be detected. So these are all the future scopes of the telehealth.
Actually, we talk a lot about telecommunications. Actually, these telecommunications are the basic ones. Actually, these were they have passed back. So what they did is, during the call, patients will explain what kind of situation they will be facing, and the doctors would recommend something. this kind of situation happens in remote areas because people won't be able to go to hospitals directly like where we have now. They'll call the doctors and they'll communicate and they'll find it, which won't be more accurate. But using telecommunication, people will be able to communicate very fast and the prescription, all those stuffs are getting updated to deliver to them at home itself. So that was an advantage. Actually, we have to see the disadvantages and the advantages of this telecommunication. Not all people will have mobile phones at the home, and not all people will have 5G connection at the home. Some may be less connected to internet, and some will be more connected to internet. So the people who are connected to the internet will be possibly more advantaged. So that's what we talked about, and it was hopefully a good communication with us.
Yeah, thank you, students. We had a wonderful discussion. In future, we will have more discussions. We will do more projects on medical field, and we will file more patents. Thank you.
Thank you.